Now, I'd like to bring in two healthcare heroes who during the pandemic of COVID met it head on by leading our frontline response in the state of Missouri. With us this morning to help us open our program are Dominique Boelow, Missouri Life Care Nurse Recruiter, and Dr. Nicole Webb, Chair and Associate Professor of University of Central Missouri. I can't tell you how excited I am to have you here today. You must tell by my voice, I'm just wondering, it's just great to have you here. Thank you for joining us. Dominique and Nicole, it's wonderful to have you zooming in. During the onset of the pandemic, you demonstrate just how important frontline healthcare professionals are to our health and wellness, and both of you went back on the front lines at urgent care, ER units, and UCI units around the state. Thank you so much for being here today.
Thank you for having us.
Thank you, Ryan.
So, Dominique, I'd like to start with you. Can you give us an example how you met the challenge of COVID head on this year?
Oh, most definitely. So my name is Dominique Boelow. During the course of the pandemic, I served as the director of our emergency services here at Mosaic Life Care. I had a team of over 100 frontline caregivers that I was in charge of and responsible for at the beginning of the pandemic. We say that the pandemic, it was a very volatile situation, very uncertain. We didn't know exactly what we were heading into. My job as the leader was really to ensure the safety of not only our patients, but of our staff. And that really, to me, is my biggest memory, going through the pandemic is the changes and different processes that I put in place to make sure that we were able to keep our staff safe.
That right there is critical. If as a healthcare individual professional, you go down, who's going to take care of us that are, in that time of challenge and need? So great point there. Dr. Webb, would you like to share a little bit about how you met the COVID pandemic head on?
Absolutely. During the height of the pandemic, I was working in the urgent cares in the Kansas City area as a family nurse practitioner. And I can tell you that being on the front lines and diagnosing so many people with COVID was just overwhelming. And what we learned from that was not only did you diagnose that person, but you may have learned something about that family. Who is it that at home that's ill, or is that person hospitalized, or did that person not make it? So as a result of coming in contact with so many people at urgent care, we learned so many stories of their plight and how things were unfolding for them. And, we also had people coming into urgent care with different severity of illness. They may have contracted COVID and they were not progressing well. So rather than going into the ER, they may have presented to the urgent care. So we also saw some of those very sick people presenting to the urgent care whom we had to send, to the hospital. But just seeing the severity of illness and just the overwhelming response that it had on people's lives was something that will go down in history and something we'll never forget as healthcare workers. And I'm glad that I was able to be a part of that and to help people and to guide them to the right place so that they can perhaps have a better outcome, or at least give them the information that they need.
That really is something that, brings across a message is about the individual stories. I know we all heard about them on television or some front lines with our family members afflicted by it, but it was their story, how it impacted them. How they were challenged by it, and maybe whether or not they survived it, and that was a key thing that we hear time and time again is that what you do early onset of any type of illness, especially with COVID, you need to seek that care immediately so that you get good people, good professional like you both to help. So you both touched on how you met the pandemic. I'm curious, do you feel that the way that you met it was the way that all our healthcare professionals today rose to the challenge?
I would think so. I can tell you, Brian, that one thing that came of the pandemic that was positive was the resilience that I saw with healthcare workers. The way that we banded together as a group, both if you were on the front line and for me also the academic side, having to transition from in-person classes to virtual options, the way that we banded together, the resilience and the strength that I saw as a unit, I think a lot of people grew both personally and professionally during this very difficult time. That's one of the things that I will remember the most and continue to see during this pandemic that we're still under, is how people have banded together and have overcome such great challenges.
I'd like to piggyback on that. The thing that I will remember the most is the integration of the health system. We all had to come together, regardless if you were a nurse, a respiratory therapist, a physician, you worked in EVS or dietary. We all had to come up with plans to be able to serve our communities, regardless of the role that we were in. And that's the wonderful thing about healthcare, is that it really does allow you, no matter what your specialty is, there's an area to where you can move into those positions. If you love computers, you can go into nursing informatics, infection prevention. All of those areas were so crucial in the interdependence of each other to keep everybody safe.
Dominique, you touched on a lot there. And, one thing that I keep coming back to is the attributes of a person in the healthcare profession, especially frontline nurses and staff like yourselves. What do you feel are those attributes like resiliency and empathy that set you apart from, say, like peers in other industries?
Number one thing around here, I always tell people, coming into healthcare, you really have to have compassion, and not just compassion for, your patients, but it really is compassion for your community. You want to come into healthcare because you want to make a difference. But I will tell you, from being on the front lines, those individuals are nothing short of heroes. And that being said, it required leadership skills among all of our staff, all of our departments. And, the one thing that I always say is, if you're going to want to come into healthcare, you've got to have grit. So grit and compassion, you've got to come to work every day, work hard, because you're not only working hard for the safety of the patients, you're working hard for the safety and promotion of your team to provide the best care possible.
Go ahead, Nicole.
I would piggyback off of what you just said. And the only thing I would add is that I think that you see such professional and personal growth that comes along with that. Of course, resilience is a huge thing. Strength, those are the adaptability. The one thing that I've seen people constantly do is, as we're met with all of these challenges, I didn't see anyone stop and say, well, I can't do this because of this. They came up with innovative ways to work that out, or to work around whatever they needed to do to meet the needs of patients and families. And I would agree, it's being able to see the full picture, not just that patient there, but the entire psychosocial, cultural of the patient. So you want to make sure that they are healthy in all ways. So I think just seeing that and seeing the adaptability and how we were able to jump in and figure out what is it that we can do to make this happen and actually get it done. I'm truly amazed with my team seeing that, and I continue to be amazed at the things that they are able to overcome and make such a huge difference in patients' lives.
All important key skills and attributes that we need, especially from our healthcare workers: resiliency, grit, empathy, compassion, teamwork. I heard that time and time again with what you described. As we begin today, what advice would you give students from around the state and the country on why they should go into healthcare? Dominique?
Yeah, I'll go ahead and lead off. I always told my nurses, even when they came into healthcare, I want you to find what you're passionate about. For me, I'm a nurse, but I graduated business school before I went to nursing. And I knew that I wanted to be in leadership, and that was, really my strong suit. And that's really just working for the promotion and betterment of others was my passion and my mission. And so even though you're in high school, there's things that you can do. Start participating in committees, get involved, but really start to figure out what it is that you're passionate about. The lovely thing about healthcare is no matter what your passion is, we have a role for you. And so I would just encourage you, keep, learning, go on job shadows, talk to leaders, reach out to your healthcare professionals and set up job shadows. We want you to come into the environment to find out where that passion is going to lead you. And our role as leaders in healthcare is to really allow you to accomplish all of your dreams within that role.
I would add to that I would encourage you to visit colleges, visit nursing schools, visit healthcare programs. As you're out making these types of things, you can meet current students who are in those endeavors, talk with them, network with them, find out what it is they like. What are the kind of experiences that they have as a student? What type of practicums do they have? And of course, the job shadowing, as Dominique mentioned, is phenomenal. If you're able to connect with a healthcare professional, I think that's a great way to get information about how that career, insight into that career that you may not otherwise get through reading something, but actually talking with and mingling with those people. I think that's huge. And healthcare is one of those fields that continues to grow. Our population is aging. It's one of those things where you will always find employment. And even if you don't quite know what you want to do, seek out opportunities, ask questions, visit, talk, network. And I think that you will find your niche. It's as Dominique said, it may take you a little time. You may have to do some exploration, but I feel like you can find your niche and you can definitely find something to be passionate about in healthcare.
Thank you. Thank you so much, Dr. Webb and Dominique, for joining us today. Great, inspiring stories and words of inspiration that are really going to carry us throughout today. And we look forward to seeing you across not only this platform today, but also beyond as we go into healthcare, and we hopefully encourage students across the state of Missouri to look into the healthcare opportunities that you have at Mosaic Life and University of Central Missouri. Thank you.
Thank you.
Thank you.